wanted to live coastally, and I was open to any state on the West Coast, and was living in Washington State at the time. And then I wanted to deliver babies. So as a family practice doc, that being true, it narrowed my choices quite a bit. Mm-hmm. But when I began to read about Open Door online, found out that they're a very large CHC system involving 9+ clinics and mobile medical, and just realized like, wow, they're pretty stable. In Washington State, we had seen a couple CHCs go under, which had only like 2 or 3 clinics and couldn't maintain ebbs and flows. So I wanted to know that I was getting involved in a larger system. Open Door, I had actually been a patient of years ago when I had been here traveling, and was like, yeah, they're just really great. And so knowing that I was going to be a CHC doctor, that I wanted to deliver babies, and Open Door fit what I wanted in terms of financial stability. So that also added to, and they have Epic as an inpatient, as an outpatient EMR, which Epic was what I was trained on in residency. And it was a huge reason about why I came here, because I didn't have to learn a whole new electronic medical record system. I could take the skills that I had learned in residency and apply it here, and it's been very good that way. I grew up in very wet, foggy places. This is what I'm used to. So for me, the idea that somehow this was a rainy area was really kind of a misnomer. I come from Southeast Alaska, lived in Seattle most of my life. So 8 months of rain is what rainy is. I don't know what they're talking about here. If it rains for a couple days and then the sun comes out. Like, it's not solid rain. It's warmer, but not too warm. So that already met my requirements. I'm very pleased. This feels tropical to me. But then the other piece was that here on the coast, I've got everything. We've got mountains, rivers that are warm. I can get hot weather if I want within minutes. I've got the ocean, fishing, great crab season. I mean, it doesn't get much better in terms of locale. I'm used to being somewhat of a distance from what I need for shopping. So either the internet actually fills in the gap, and when I was little, it was always. So I'm used to being away from stores and things, and that's not really primarily important to me. So that's why I knew rural was going to be fine, and especially in this area. I actually have an amazing number of artists in the community, great restaurants. There's like quilting shops and bead shops, and if I was into high-end anything, I could also get that. Like, it's pretty amazing how much I can have right here that I don't need to go out of the area for. Costco, Target, that kind of stuff. So that's good. And so it's rural, but not that rural. Let's see again about my perspective, I suppose, because in Alaska, like, there's a village life. That's not where I lived, but I knew a lot of people who were way out without plumbing and stuff like that. So for me, like, this is really great. The community itself has actually been a real wonderful, meaning the people here and the clinic community. It's been a real surprise. I think we're a young family. So my husband and I have 2 children, ages 7 and 2. It really surprised me that for a community that's known for things that are not for children, we'll just put it that way. I was like, well, I don't know about this. Like, how would it be if, there's this whole trade black market stuff in my town? I don't really know. We had spent a year living in. So I had these concerns, but all of it washed away when I was here. This is primarily a college town with a lot of young families. There are kid activities every weekend. There's a beautiful farmer's market every week. It's been a real joy for us to discover a lot of families that are a lot like us, and a lot of really great activities to connect my kids to the community and feel really excited to be here. So that's been a real joy to find out. I don't think we really had said it had to be that way. We kind of thought, well, maybe we'll leave after I finish my time. Right now, we're going to stay. So I'm just really pleased with what Arcata has brought to us. And Open Door as a community health clinic has in its decisions tried it every time when we're talking about a decision, has gone back to its mission. What is it doing for patients, patient care? I think that there are always hard decisions to be made on the clinic side, but I don't see it being purely profit or survival for the clinic before patient care. Maybe that's part of the fact that we're fairly solvent. We don't have a big problem here, but I've just seen CHCs begin to have a real hard time keeping their priorities about how they care for patients and put them in the primary spot. So it's been a real joy to be with physicians who have balance in their life, In fact, the closest analog to me, sort of the person I consider my mentor, is a great family man and has always been able to keep that balance. And actually, one of the reasons I really like staying here is that he teaches me how to do that, because it's not taught anywhere else. It's not encouraged in medicine. So that's been a real blessing too, that the fit is good. I think it's really that, my challenge is to find balance, become a better doctor, continue to learn about what I'm doing, ask questions, feeling like I'm part of a team, to not lose that camaraderie of residency. I don't know. You come out of residency and sometimes obtrusively, you're always asking questions and having questions asked of you. And it's both painful and a relief, because you think, well, I can just ask my questions. People are supporting me in talking about how it didn't work or what I was worried about. And I found that I can do that here too. I didn't have to let go of that and create some artificial belief that I've got it now. Like, oh great, I finished my education. I got it. Of course you never got it. Nobody ever finishes learning. So that's been a real joy to be here and feel supported in that too.